Welcome to the participant story. Real people, real voices, and real experiences from inside clinical trials. In each episode, we sit down with a different guest to hear why they volunteered, what they experienced, and how participation in clinical research has changed their lives. The participant story is brought to you by Curevit Clinical Research. Curevit leverages technology, local healthcare infrastructure, and decentralized clinical trial elements to design and execute clinical trials where participants come first. Learn more about Curevit and their innovative virtual clinical site at curevit.io. The participant story is hosted by industry veteran and entrepreneur Dave Hanneman.
Linda, welcome to the participant story. Real people, real voices, and real experiences from inside clinical trials. As we've talked about, this is a podcast where we look to be able to tell the stories of caregivers and participants in clinical trials. And I am really psyched to have you on today because, as we may discuss a little bit, we have a little bit of a history working together in the past. And you are also the voice of the podcast who does our introductions for us. And it was actually in that conversation that I thought that you might be a great candidate to be interviewed. So thank you so much for being here today.
Thank you for having me. This is exciting.
I'm really excited. Let me get started, Linda. I'll do a quick introduction of you and then you can fill in around the edges. Linda started her career as a professional actor. Her part-time support job then became a 26-year and still going career in pharmaceutical and life sciences at a support company where I've had the pleasure to work with Linda in the past. Her role, interesting, includes training, quality assurance, and process improvement. And as we were talking about right before we rolled the camera, at one point, Linda even trained the drug development life cycle and a course that we developed called Clinical Trials 101 for service desk teams, which were supporting clinical trials. I'd forgotten all about that. So Linda Doherty, thank you so much for joining us. Welcome to the show.
Thank you. Thank you. Yes, it's still with that same company through 2 buyouts and still doing what I love to do in support of the pharma and clinical trial industry. It's still very exciting to me.
I'm so grateful that we had the chance to work together all those years ago. And I'm so grateful that we're still in the same industry. And it's particularly gratifying for me that you're able to join now on this podcast to talk about this other aspect of your life that has been, I think, obviously quite an important and meaningful process in your life. So let's just start with clinical trials. How did you first hear about them?
At work. So when our company started going into that pharma niche and working with supporting pharmaceutical sales reps and then getting more niched into clinical trial support, I had moved into a training role and took over training our help desk agents on the drug development life cycle, which dove into the clinical trial process, eventually leading to another course we called Clinical 101. And I understood how it all worked. We talked about the pros and cons. We'd have, agents and new hires talking about the pharma industry with skepticism, but we were able to show them, hey, this is what it takes to develop a new product, and the money, the research, the work that goes into a clinical trial, and explained, we said, not good or bad, this is what it is. And I found it very interesting. It was very complex. And at that time anyway, it was a long 20-year cycle that we were training about.
So at that point, when you were learning about clinical trials through work, had you ever had experience personally, or had you heard of them? Had you had a family member or anyone you know go through a clinical trial?
No, nothing. I don't think it was on my radar at all in existence. Hadn't thought about it. I mean, I probably knew they existed at some point, but hadn't been part of my world at all.
And so then, and the reason that I thought you'd be such a phenomenal guest on the show is Then you, several years later, had a much more serious experience with a clinical trial as a caregiver. Do you care to talk about sort of from that moment you learned about clinical trials, you're young, think you were single working in a support company, and then how you found yourself, several years later as a caregiver in a clinical trial?
Yes. Well, it turned out I met my husband at that company and working on a project together, kept it a secret for a long time until we got engaged. And then we continued to work at the company. He actually then did leave and worked still within the pharma industry. He was on the IT side. And it was 10 years after we got married, but a little less than 10 years. He had started having back pain and was trying to figure out what it was. And at the time, the company he was at was being bought. So, as what happens, work slows down. He had a lot of time, and we said, focus, focus, focus on this, and going to every doctor imaginable. And 9 months later, 8 or 9 months later, we finally got the diagnosis that he had pancreatic cancer.
Mm.
Not an easy one. He was only 36 years old at the time, so it wasn't something that doctors were even thinking of looking for. And it came about through the pain was in a part of the back that you have to be in a serious car accident to really injure that. And the doctor basically said, fine, I'll do an MRI to shut you up. And what they saw were spots on the liver. And that led to biopsy, which led us to find out it was pancreatic cancer, stage 4 at that point. And we did what everybody does that you're not supposed to do. The doctor says, don't Google it, and you do. And you get terrified. It is terrifying. And so we had our appointment with the oncologist at the hospital that is 5 minutes away from us. Wonderful doctor, laid out what we could do. And we said, well, we were aware of Memorial Sloan Kettering in the city being the cancer research hospital. So we had asked about that as well, or if we actually just asked straight out if there were clinical trials because of knowing it from the industry. And the doctor we were talking with happened to have worked for the head of the pancreatic cancer department at Sloan previously. So he called and got us an immediate appointment. And we found out there was one trial that was open for enrollment that he could join. And, in talking to both, the doctor from the local hospital said, sort of a no-brainer, he would go with the trial. And that is what we were thinking. We just, from our background, understanding it, we know there's no guarantee, but we thought this is what you have to do. It could turn out great, particularly with pancreatic cancer. We thought at that time, it was 2014, there was nothing. There was next to nothing except something called the Whipple surgery, which he wasn't eligible for. So we said, okay, let's do it. There's really no choice. It was something that I guess from our background, we felt driven that we had to do. And the nature of the cancer, we thought this was the best option.
So it seems like in many cases, in many stories, there's a decision between an experimental clinical trial that may have risk or downside or what have you, and standard of care treatment or some other alternatives. It seems like that was not a tough decision here, that the standard course of treatment was not going to go the direction you wanted. And so therefore, sort of, why not? Was that the thought?
Yes, sort of. The standard was a stronger form of chemo, one of the products. The trial had the not as powerful chemo, but added on the trial drug. And given the state, it really was, there was just no telling what would happen either way. So we said it's worth the try to see what happens with the trial drug. Talking to that doctor, she made no promises. She said, our hope is to get you maybe 5 more years. They can't give away anything about the trial. So even though we understood that, we thought we're going to ask those questions. And, she was very good. She said she couldn't tell us how well it was going, and that's what we wanted to know, but they can't say that. So,
Yeah, so for the listeners, describe that dynamic, the restraint on the physician and the questions that you were trying to ask.
Right. The data is, I guess, for lack of a better word, sealed. They can't discuss the results of the trial during the trial because it could influence it. So all the data is sealed. Now, she obviously, in having other people within the trial within her realm, she would know, but she couldn't say outright, yes, it's going really well, it's going to work, because it hasn't been approved yet. She could only say that they were hoping that it was showing positive results. And she tried not to give us false hope because they can't do that. She was very direct. It was very direct. And I think maybe if we weren't aware of the industry, it might have been a harder decision, because it also meant for us living in New Jersey, driving into New York City to Sloan once a week.
Yeah.
So it might have been harder for some people, but because we understood the background on what she was telling us, we just said, we got to do it. It's worth a try. And we knew we'd get good care.
So it sounds like the decision was pretty quick. It was worth a try. You were doing it. You mentioned the commute in New Jersey to New York. Besides the commute, were there other factors that were part of the decision? Even though you knew you were leaning that way, were there other considerations around either the type of care or financial considerations, commute considerations, lifestyle considerations, anything else that was part of that decision-making process?
It's interesting, the type of care and the financial decisions. I can't say they were a big factor because the hospital near us is also very good, and they were expanding their cancer center. We felt confident we'd get good care. We were aware that in clinical trials, everything is covered, but I don't think we knew what everything really meant. And so I won't say it was a factor because we made the decision. In the end, I don't know what it would have cost if we hadn't been in the trial. But yes, everything was covered. And when I say everything, there was other things that would happen. And the care that we got at Sloan, everything. So, when Rob complained of, I don't want to say headaches. I can't remember exactly. It was 14 years ago, but things, he started to think there was a tumor in his brain. I mean, we thought the cancer had spread there, and they took care of it. They set up appointments with neurologists, ophthalmologists, had everything checked through. There was one point when he was getting a rash, go right, one floor up or down to the dermatology department. They took care of everything. I can't say enough positive things about the staff and the care. And I don't know clearly if that's because it was a trial or because it was Sloan, where they do a lot of trials. So it might have been everything all together. I want to say it made life easier. It was good to know. Anytime he had something, they were so open. They said, just call. He would call. They would make appointments. They would help take care of what needed to be done.
What was the structure of the team? Did you have a single point of contact? Did you go to different people for different things? How did you coordinate your inquiries, and how did they coordinate their support?
It was a team, but there was a single point of contact, and there was a number. It was to that doctor's office. Whatever assistant was helping would coordinate everything else. So when we needed that ophthalmologist appointment or that neurology appointment, they called, they coordinated, they got it set up. So we always had a single person to go to, and our oncologist was our lead person. So we'd meet with her or we'd talk to her. She was available anytime we had questions. I want to say it was a team, but we had our single contact. We didn't have to do anything ourselves.
So shifting a little bit, Rob is a patient and he's getting care. He also now becomes a participant in a clinical trial, and those are not necessarily the same roles. And then you're the caregiver supporting both the patient and the participant. Maybe talk a little bit about that dynamic and how that evolved. And did that evolve over time from the time you decided to, well, you got the diagnosis, you found a clinical trial, decided to go into it. How, if all, did that dynamic change, and how did your role change?
As a participant, Rob was very active in giving feedback.
Yeah.
Um, and they were very open and accepting. I mean, treatment alone, it was going in once a week, 3 weeks on, 1 off. It was a day of getting the chemotherapy. But the actual investigational drug was delivered by injection that he had to do, I think it was daily. So that was all take home. And that was very interesting because giving yourself shots is not easy. And I was amazed at his ability to do it. That would be a setup. That would be both of us together, laying everything out, getting it ready, figuring out, doing the shots until he got very good at it. But it did cause a lot of bruising. And so he brought that up, and he actually, I think it first came up with our pharmacist who was helping get certain supplies. And she said, "Hey, I wonder if it's the needle size." And so we went back to the oncology team and talked about it and was able to change and get a smaller needle size, make it more comfortable, make it easier. So
Hmm.
I know that that was something that he felt, hey, we're contributing to this trial. Whether, if the drug's successful, how it's delivered needs to be somewhat comfortable. So he was able to participate, add improvement to that effect. We got that changed, at least for us, as part of the process. As part of the caregiver, it's just hard, right? It's hard because at the same time, everything is focused on that. But we also have 2 young boys, very young boys, 4 and 7 years old, still working full time, trying to organize all that. So it actually goes back to the care team for the trial and at Sloan being able to answer everything. I mean, you knew Rob, project manager, very organized. So I had complete comfort that he was getting what he needed, but I was there as the support, checking in, like, okay, what do we need to talk about today? What's going on today? What's your schedule? But I could also take care of the family, make sure they were okay, juggle everybody's needs. It's a lot of work.
I can only imagine, and the role of caregiver, they say, is the hardest one. And I suspect that Rob also was happy to know that you were paying a lot of attention to those other aspects of life too, right? I assume he didn't want to take up all the oxygen in the room. He wanted to make sure you were looking after the kids and so on and so forth.
Yes. Yeah. Yes. And the other good thing that so our oncologist, Dr. O'Reilly, also happens to be on the board of the Pancreatic Action Network. She mentioned that organization to us. That became another support layer. We only made it to one meeting, but in that meeting, the group of people was talking about their upcoming fundraiser, which is Purple Stride. It was a 5K run walk at the time that they do every year. And they were talking about, the event, the raising money. They went around and introduced themselves. They were so welcoming. Rob was so moved. He started crying, thanking them all because here's complete strangers raising money to find a cure for the disease that he had.
Yeah.
And between that and letting them know we were participating in a trial, because PanCan raises money to support clinical trials. So it was all full circle, but it added another layer of support for us as a group because the head of that, the chapter, checked in on us, called. She also gave us a lot of support and help.
I'll try to remember to come back to this at the end, but I believe you're still working with that organization. Is that correct?
I do Purple Stride every year. I've done it every year since, Team Doherty, whoever can join. My sisters-in-law participate. They come do the walk. Friends come do the walk. I, do my best, my part to raise money to continue. It's a great group. They have done phenomenal work. They've come a long way. So in 2014, almost nothing. And it's shortly after, and so Rob only lasted 4.5 months, and we'll get into that. But shortly after he passed away, probably within the next 2 years, a lot of new options became available. More trial drugs, more drugs that worked. They could mark your tumor, like identify your type of tumor. A lot of things have changed. So the survival rate has greatly increased. It's still very small, but it's greatly increased since then. So it's one of those things I try to stay involved in to ensure we keep moving this forward.
Well, that's great. I'll try to remember to come back to that when we wrap up, and
Yep.
we'll make sure that's in the show notes, and we'll pop it out on LinkedIn as well. So let's come back to the very first visit, maybe even the information and consent process. What was that like? Did you learn something you didn't know? What was the process like from the time you'd made the decision and then you started to go through the actual consent process and went to your first visit?
There's a lot of paperwork to sign. I remember that. I remember we had the visit. We went forward with getting a port put in for him before we made the decision, but he needed that either way. So we did that at the local hospital. And then from the minute we said yes, it was very fast and very efficient. Enrolling him, filling out all sorts of paperwork, which at the time was still all paper. It's electronic now. Working with, I don't even remember the various departments, but I do know when we went in, the entire process was so organized. There's a waiting room. You're going in. You're getting your blood drawn if that's part of it. Then they're taking you to the back room, going through the treatment, and then the whole introduction of, as I said, he had to do it through shots. That whole process, getting the kits sent to us, working with him on how to do it. It's very, very organized. There wasn't any moment that we felt concerned about the trial or what we were doing. There was always fear. I didn't want to say we weren't scared. There's always fear, but that's because of what we were going through. But every person on the staff was so helpful, concerned, there to answer questions, ensure, he was comfortable during the treatments, that we had the right follow-up. We would sit in the waiting room and talk to other people, and it would be other cancers and other issues. That's when we learned the word immunotherapy, which was somebody was going through treatment for that. I think it was a lung cancer. And we're like, gee, we asked about it, but it just wasn't something for his type of cancer at the time. So, participating in trial, there are great processes. They're very solid. That's what I'm about, process. Can we get through it easily? Even the financial processes of getting registered on their portal and understanding what would or would not be charged, they make it very easy. They make it very understandable so that there's really no stress. I think the goal is don't add to the stress of the patient, and I think that was very successful.
You talked about your role as a caregiver and full-time employee, mom, husband, caregiver, et cetera. How did your daily life evolve and change during this period of time? And then where did you go for support? And did that come from care team, other family? Where did you find your support as your role evolved?
Well, I was lucky enough that my mom happened to be moving to the area by us from North Carolina because she wanted to be near her grandchildren. And she had moved up a month before Rob was diagnosed.
Wow.
Was staying with us, trying to figure out the area where she should live. And when we got the diagnosis, Rob said to her, "Don't go anywhere. We'll need you." So I had that support of my mom helping with, kids, whatever I needed to do so I could work, get the kids, go grocery shopping. It was also great because during the day, if I was at work, she was here with Rob and they would go out. So there would be something he'd
Nice.
learn about, I can't remember, there was some Asian vegetable, she would research. Like this was really, so they'd go out and buy it and come back and try it. So knowing that was my support, knowing that I had that extra. If I didn't have that, I think I'd have been more stressed about not being home all day, even though I
Very
had the
lucky.
flexibility. Yeah.
Yeah.
But I went to every chemo treatment, so supportive work environment where I could do that, work remotely or, be in and out as I needed so I could be there with him. I think that's very important. The work environment that you have. And what's very interesting is that Rob had had an employee going through cancer treatment before, and he had said, whatever you need, just go do. And I feel like that was the pay it forward. Then it came back, he was going through treatment and was told, whatever you need. And me as his caregiver, very supportive by everybody I worked with, which you know, whom you know well, let me go do what I needed to do. And I think that's very important. And then my friend group as well. They were all here. They'd stop by, giving me breaks so that I could get out, do something, and take a break.
Yeah. Oh, that's great.
Yeah.
So how long did the trial experience last for you? How did that progress? And then were there any surprises in the course of your experience?
The way it worked, I think it was 2 rounds. So it was like 8 weeks before they do another scan to check how it's working.
Mhm.
It was showing a little bit of work, like reducing some tumor size. So we were feeling positive and kept going. Somewhere around the 2-month mark after that, the cancer was too much. We saw it.
Mhm.
We could see it. So the trial didn't end for us. What ended was Rob's life,
Mhm.
and that ended everything. Otherwise, the trial would have kept going. So he was doing the shots. We were doing everything right up until the last few weeks. He had been doing everything. We had gone away on a vacation with the kids and got back. He wasn't doing well. Decided we needed to just go in. It was going in for his chemo day, but we actually went right into their hospital location, their emergency room, as opposed to the chemo, because
Mhm.
something wasn't right. And that was the beginning of the end. Then that was
Right.
about 2 weeks later. Yeah.
I'm sorry.
So,
The trial went on.
yes,
Do you have any sense of how the trial did?
I do, because I was tracking the drug just to check on it. It did not prove out to be effective enough. So it eventually ended, not as an option. But having gone through it, I'm still glad that we did, because we helped show that.
Mhm.
You need to know everything. You need to know the good and the bad. And I don't think that it was a bad thing that we were part of the trial, because looking back, he was stage 4. It was pretty late. It's an aggressive cancer. It's a low survival rate. But there was an option. We showed it worked a little, but just not enough to make a difference. So I know the product was discontinued, or the research discontinued on it.
Your story's hard to hear and it's tragic. And it's also, I think, important. And I'd like you to maybe say more about clinical trials. I think there's a perception out there that clinical trials are a panacea
Mhm.
and that, gee, if you're sick, you get in a clinical trial and that's how you get cured. But your experience is different. And as
Mhm.
you well know, being in the industry, a lot of things are tested for a very long time. Not that many of them actually work.
Mhm.
So talk a little bit about that dynamic of being in a clinical trial, successful, unsuccessful, risk, opportunity. It's a real decision.
Yeah. There are times when it goes through my head saying, what if we had gone with the stronger chemotherapy and not the clinical trial drug?
Mhm.
Would that have changed the outcome? You can't, as a caregiver, you can't keep going there. You just can't. You
Mhm.
you make a choice and you go with it. We made that choice and we've remained positive, maybe blissfully ignorant, hoping that it would work, right? But you, you have to go with that choice. It is risky, and you don't know. As I said before, like the doctor couldn't even tell us. They're not allowed to.
Mhm.
But I think the commitment of people who make the decision to do the trials is so important, because you have to know what works, what doesn't work. And yeah, when I taught the course, I don't even remember the numbers at this point, how many drugs would start out in phase 1 and never make it to phase 3 or be released or approved. And the
Mhm.
amount of money that goes into the research, having gone through it, I can see why it costs so much. I mean, the number of visits, the extra doctors we went to, the first couple of visits we had to stay overnight in the city, all of that was covered. and
Mhm.
overnight in Manhattan is not inexpensive. And so I see the cost of it, but it has led to so many other options in at least the pancreatic cancer world. I can see there's, with all the trials that have happened now, they've extended I think it's the 10-year survival rate. They're into the double digits. That was a huge feat. It was around 4% when
Mm.
Rob was diagnosed.
Mhm.
And I think it's up in the teens now. So it's still so important. You've got to know that you're right. It's not a guarantee that you're going to survive, but if you don't know your survival rate anyway, based on the cancer, I look at it as, why not do the trial and
Mhm.
add to the knowledge that helps us find cures for some of these diseases.
So how has your experience as a caregiver and also working in the space, how has your personal experience as a caregiver with clinical trials changed your outlook, the choices you've made? Has it had an impact on your life beyond the trial itself?
Uh, I'm fully aware of clinical trials. I know about some products because of the company I work for in the industry. And um, funny, not funny, strangely, my s- um, husband's sister's husband was diagnosed with a form of cancer. So I was immediately saying, I know
Mm.
there's a product that's already gone through, it's been approved, that is for that. Please get this, and find out. So I was able to give her a lot of information and resources to try to help them determine, a path forward and what to do. In conversations with other friends or friends of friends, when I hear about, what cancers they may have, it's my first thing. Okay, if you don't have something, find out the clinical trial or ask if there's something in trial. I do encourage people to at least ask and find out if there's something, because again, it could be great or it may not work out, but sometimes a trial doesn't work out. It doesn't always mean death, as it did in our case. That was separate from the trial. It could be that whatever product fails, but now you've learned that that doesn't work. You've added to the knowledge. So I do try to encourage people, or at least offer that up as an option that they should research.
Is there anything that I haven't asked you or that you'd like to talk about that we haven't talked about?
Oh goodness. We've covered so much, and I'm looking at the things I wrote down to make sure I didn't forget. I think we covered. There was, again, it's just it's so important to be a part of this and to keep it going. It's hard to hear, like in my situation, it's hard to hear about survivors, but I'm also very happy to hear about them.
Mhm.
I go, why couldn't have that have come out 2 years earlier?
Mhm.
But even despite all that, as the caregiver, you have to know you're doing the right thing. You're working towards something bigger and better. And I feel like in my work life, I'm supporting that as well. And I just think it's important for anyone even considering it to do give it consideration. Ask around or ask about organizations. And like I said, for pancreatic cancer, there's a couple of organizations. I know there's, obviously breast cancer, there's a huge organization. They're there that you can go to those resources, ask questions, and find out what trials or get more information. The information you're getting is from other clinical trials. So again, it's a cycle that we just need to continue.
I really, really appreciate you spending this time with me today and sharing your story. It's been interesting for me in the short time we've been doing this podcast, how number one, these are hard conversations. These are difficult memories. Even folks I've talked to where the outcome has been great, they're still very difficult memories.
Mhm.
And so, thank you for being willing to share that. I've been amazed at how willing everyone is to share that and share their experience because of and in some cases, the experience wasn't great, or there were aspects of the trial that weren't great. Most cases were like yours, where people loved the team, loved what happened. But across the board, people seem very happy to share their experience, simply to get it out there for future participants and caregivers to get a leg up on making their decisions and going through what they have to go through. So I really hope that this podcast gets out there to a few people. I'm sure it will. We do this podcast because we want sponsors to understand what this is like, but we especially want participants to be able to tell their story and for other participants to hear about it. So thank you. A couple of other things, Linda. I will say, and I'm glad you shared your story at the company we worked at together. You and Rob were independently some of my and our favorite colleagues. And then one of my favorite stories that I tell about that, because we had that company from founding to exit. And one of my favorite stories is your office romance, which you kept secret and between two of our favorite people. So that was really, so thank you for that as well. That's a fabulous story. And then last but not least, I think it's PanCan was the organization that
Yes.
you still support. We can put it in the show notes. Do you know how people find it off the top of your head?
Yeah, I believe it's pancan.org.
Okay.
And Purple Stride is the annual event for which we do Teen Doherty in the New Jersey chapter to, raise money and do the stride.
Awesome. We'll get that out there. What time of year is
Okay.
that?
It's in April. It's the end of April.
Cool. So we've got a few months to ramp up.
Mm-hmm. Yes.
Well, Linda, thank you so much for participating in this. Really appreciate it. On behalf of all the future caregivers and participants who are going to hear this, thank you very much.
Thank you, Dave.
The participant story is brought to you by Curevit Clinical Research. Curevit leverages technology, local healthcare infrastructure, and decentralized clinical trial elements to design and execute clinical trials where participants come first. Learn more about Curevit and their innovative virtual clinical site at curevit.io.